Several children have been diagnosed with a deadly coronavirus-related illness. While still rare, cases are on the rise here in the Baystate and across the nation. Beth Ward spoke exclusively with the chief of infectious diseases at Baystate Children's Hospital, and she joins us now live from home with what parents need to know. Beth.
Well, Chris, Dr. Donna Fisher at Baystate wants parents to know that while this is making headlines everywhere, do not panic that this is still rare. However, she and the CDC are asking parents and physicians to keep an eye out for symptoms of something they're calling PIMS syndrome.
Children across the country are being affected by a COVID-19 related illness being dubbed PIMS, or Pediatric Inflammatory Multi-Symptom Syndrome.
The way that it's presenting in children is quite a bit different than what we were seeing over the past 4 weeks, mostly in adults, requiring a lot of support for severe respiratory symptoms.
New York City hit hard with at least 102 cases. 3 children have died. But PIMS is being reported now in at least 14 states, including Massachusetts. Baystate Children's Hospital's chief of infectious disease, Dr. Donna Fisher, says that includes Baystate Children's Hospital.
Very few. We're ready for them. We are working with our Boston colleagues, particularly the rheumatology and cardiology group in Boston, who have a few more patients than we do.
Doctors say it is similar to toxic shock, or something called Kawasaki disease. It affects blood vessels and arteries and can be deadly.
So what we're seeing in children now over the last couple of weeks here in the United States is this inflammatory syndrome that looks like it affects the heart potentially, and also causes some other signs of inflammation in other organs.
Dr. Fisher says symptoms include persistent fever more than 5 or 6 days, abdominal pain, diarrhea, vomiting, rash, difficulty breathing, confusion, and sleepiness. She emphasizes this is still a rare complication, but catching it early can be critical.
The main thing is to, call your pediatrician if you have any of these concerns about your child, and get some advice quickly over the phone, which most offices are really prepared to do.
And keep in mind,
most of these children either are not getting sick at all, or they're having very mild disease and not needing to even go to the doctor's office. We've had a very low rate of children in Western Mass that have actually needed to be admitted to the hospital for COVID.
Now, the CDC plans to issue guidelines on these new symptoms and what they know so far to doctors. That's going to happen tomorrow. And earlier today, I talked with the Massachusetts Department of Public Health, who tells me that they are collecting data, working with hospitals to determine the same and to figure out the numbers here in Massachusetts. Reporting live from home, Beth Ward, Western Mass News.